Now I welcome Dr. Amrutha Manoharan ma'am. She is from Thiruvananthapuram, Tamil Nadu. Years of practice is 10 years. She completed BHMS and MD from Sharda Krishnan Homeopathic Medical College. She is doing diploma in yoga. With this introduction, I welcome you, madam.
So, good evening, all. Good afternoon. So, my topic is about renal calculi, right? So, my topic is about the this is a phytochemical, urolithic, and review study along with the case study on the action of homeopathic medicine, Hydrangea in renal calculi. So, renal calculi is also known as the kidney stone. Is one of the most prevailing disease nowadays. So, is the screen visible? Based on the location of the stone,
Yes, madam.
the symptoms. Okay, thank you, sir. So, based on the location of the stone, the symptoms may vary. Renal calculi, it is also known as urolithiasis. It constitutes one of the most prevalent urinary stone disorder. Mainly, it is characterized by the crystal deposition, mainly calcium oxalate, uric acid, struvite, and cysteine crystal within the renal tubules. There are many factors, mainly include the oxidative stress, urine supersaturation, and also urinary citrate formation. Tubular injury also plays a critical role. So, hydrangea, it is a homeopathic medicine. It is traditionally known as stone breaker. It is mainly used for renal calculi, dysuria, and gravel deposits. What are the main cause of renal calculi? It includes dehydration, that is the dietary error factors, and family history also plays a role. And also the excess supply of vitamin and calcium D supplements also constitute this renal stone. The mainly four types of stones are there: cysteine stones, calcium oxalate stone, uric acid stone, and struvite stones. The main symptoms include fever, stomach pain, vomiting, dizziness, blood in urine, and back pain. So these are the main complications, which include retention and stasis of urine, hydroureter, hydronephrosis, and destruction of nephrons along with the kidney failure. So the main lab investigation include urinary, we mainly look for the RBC and crystals in urine pH, and also test for the blood calcium, uric acid, creatinine, and urea. And the main imaging studies include KUB, USG KUB, along with X-ray KUB and non-contrast CT scan. So hydrangea, this is a homeopathic medicine which is traditionally used for renal calculi. So it has a main urolithic action is there. So the urolithic action is demonstrated in vitro and in vivo. In vitro, hydrangea shows inhibition of the calcium oxalate crystals and aggregation in vitro, suggesting the capacity to reduce the kidney stone formation. Mainly 30 potency is having the main action. And next is the phytochemical study. The main constant include hydrangean, saponin, flavonoids, phytoesterols, volatile oils, and resins and tannin. The urolithic action, it is mainly by the hydrangea have demonstrated reduce the size of kidney stone and also inhibition of the crystal activity along with the reduced size of stone. The kidney protective models are there. The main kidney protective models, it shows renal tubular injury action. It has a main action reducing the renal tubular injury, calcium oxalate deposition, and it has main role in reducing the inflammatory markers like interleukin 6, TNF alpha, and oxidative stress biomarkers. On the diuretic action, it has marked improvement in the urinary volume, urinary pH, citrate level, and reduced oxalate and citric acid. So this is a case of 21-year-old male who is present with the renal stone, hydronephrosis. The patient also has a burning maturation and also abdominal pain. So hydrangea medicine was given, and this is the investigation before the report. There was a right uretrovesical junction calculus along with hydronephrosis was there, and after the treatment, the complaint has perfectly revolved. There is no case of renal calculi is there, and no case of hydronephrosis is there. So I thank each and everyone for giving me an opportunity, especially the Swara Gurukul team and the entire team. And thank you for giving me an opportunity.
Thank you, Amrutha ma'am. It was nice presentation with in detail description about the drug with their phytochemicals and everything. Thank you for your presentation. So now we have completed the category 1, all the cases, all the presenters. Now we are going to next category, second category. So we are going to see many interesting cases. We can learn many practical tips from these cases. So with this, I introduce next presenter, Dr. Aravinda Gundepudi. She's from Pune, Maharashtra. Years of practice is 12 years. She completed BHMS at Allu Ramalingaya Government Homeopathic Medical College, Andhra Pradesh. She also did basic course in sensation method during COVID. She joined in Dr. Shekhar sir's webinar where she felt he is the right guru for her and following him. So with this introduction, I welcome you, madam.
Hello,
Yes, madam.
good morning, all. I am glad to be a part in the 100th SODP. Now I'm starting. Uh, yeah, able to see?
Yes, madam.
Yeah.
Make it full screen.
This is the uh,
అక్కడే పైన
slideshow. Yeah.
అక్కడ కాకుండా కిందికి రండి మేడం.
Yeah, from here. Okay.
కింద ఉంటుంది చూడండి.
ఇది ఓకే కదా? ఓకే.
ఓకే
A case
కానీ
of
స్లైడ్ ఇది వీడియో లాగా వెళ్ళిపోతుందేమో మేడం.
no, నేను అది ఎంటర్ చేస్తాను.
ఓకే డన్.
Yeah. This is the case of stress and anxiety in female 34 years. And her chief complaints are it's like she is married and married for 15 years. Her chief concern is emotional distress due to the lack of value, trust, especially with her husband. Stress related to family concerns and personal identity. The presenting complaints, the persistent anxiety and stress about family, children, and daily life. Excessive thinking about the small matters, feeling of sadness, loneliness, and neglected feeling, sleeplessness, restlessness, mental tensions, lack of concentration, memory weak, irritability, and low hemoglobin since childhood. Hair loss, chills, dyspnea, flatulence, and heartburn. She mentioned the irregular menstrual cycle with occasional spotting. White discharge is there with no itching and drawing pains of both legs. She came with these complaints at first, but she didn't mention more into personals because her husband is there with her. So I gave her it's like some medicine depending on that these complaints, and I told her like after 1 week we'll go for follow up. In that 1 week, I told her clearly like you should tell me in detail, then only I can help you, and you please make privacy and tell me clearly everything. And she told the mental general strong need of emotional support, trust, recognition, and feels husband does not share financial personal matters. Feels left alone during the conflict with in-laws. Desire for personal identity and independence. Sending money to her in-laws does not bother her. However, he does not discuss these matters with her, which makes her feel undervalued. This is her main concern. Despite of 15 years of marriage, she feels that her husband still does not trust her. Strong desire for respect, recognition, and emotional support and lack of these has led to feeling of restlessness, sadness, and disappointment. And she told it's like many years she reported feeling unhappy. From many years, she is feeling unhappy and unable to enjoy daily activities, including the food also. She describes the persistent sadness and the depressive thoughts and continuously occupied her mind. And when I asked her why you were with your husband only, even you are facing all these issues from past 10 years. And she told like she told and she cannot imagine her life without her husband and considered him as a good person. Her primary concern is his lack of openness and trust towards her. She expressed that if he is emotionally open and trusting, she would feel extremely happy and fulfilled. And she told like openly, I am sharing everything to him, but he is not at all telling. That's the main concern to her. She recently started taking tuitions not for financial reason but with primary intention of gaining recognition and value for her in-laws and from her in-laws and family. And here it's like I take that this is the clear-cut case of third superclass because her issue is transformation from unknown to known. They want to be, but they cannot do as the restrictions from within herself. Here, nobody are restricting her. It's like she can do whatever she wants. She can go outside also. She can do the job and everything, but the limitations and she only keeping by herself. And confusion and the main issue here is identity and image. It's the clear-cut case of mineral kingdom, and there is because there is no sensitivity issues and hierarchy issues. In mineral kingdom, this case belongs to the third row because the superclass, I mean third superclass, it's like third row. The rows and columns. The main issue of third row is love, care, image, and identity. This is the case of salt. So the patient belongs to third row, first column, sodium. She is completely depending on her husband. So much of anxiety, wants one-to-one relation. And she mentioned one more thing when she is about to marry. At that time, she is in degree, engineering, final year exams. But her husband told you can write the exams afterwards, and she obeyed that, and she went to marriage. So that means she is completely depending on what he is telling. She is just following that. So she is expecting from him the same thing. The 17th column, chloride, this is the betrayal feeling. She is trust. Trust is the main issue in this case. So I gave the drug natrium muriaticum 201 dose, as the case is in emotional state. And here I used the sensation method for prescription. This is the reference. I referred the Sankran Soul of Remedies book. And here also the main feeling of natrium is that she will be let down or betrayed or disappointed by the person her trust depends on. So it's like I hope that everybody reach the same remedy after you heard the case. This remedy works very well to her. After this 1 month of this take the medicine, this is the review. She wrote like this, like almost all gynec that was the menstrual problem is there, that is sorted. Now she is feeling better. So much positive impact is there in her daily life, and she is managing the stress things and anxiety also. And she told one more thing, like whenever if sudden any people, it's like visiting anybody come to home means she is so much stressful about that. She is so anxious. She is in confusion. She don't know what to do also. She is like continuously nagging with these small matters to the husband and children. So that one also sorted out. She is fine, but the treatment is going on. Even yesterday also I spoke to her. She told like it's like almost all she is recovering, and she is doing what she want. She joined in some yoga class and meditation and everything also. As James said, Tyler Kent told, if you love homeopathy, it will love you. This like I'm saying that these days. Yeah, thank you, Dr. Sekhar sir and Priyanka ma'am and whole Swara team. And thank you everybody.
Yes, madam. Definitely, we love homeopathy. Thank you for your presentation. It was nice presentation, and you were added the newer understanding of superclass. With this understanding, you have cracked the case. Thank you for your presentation. We move to our next presenter, Dr. Anand Desai, sir. He is practicing at Himmatnagar, Gujarat. Years of experience of practice is 18 years. Also working as a professor and PG guide at SMT AJ Savla Homeopathic Medical College at Mehsana, Gujarat. So with this introduction, I welcome you, sir.
Yes, Dr. Banu.
Yes, sir. Fine. Done.
Yes, yes. So first, I would like to congratulate whole Swara team for celebrating these 100 sessions. So today I present a case of a boy, 8-year-old, and he is having the pustular eruption on the scalp, face, and the also having the recurrent tonsillitis. We can see the video. So in some scalp region, we can see some scabs and these thick yellowish discharge. We can see one lesion on the top of the ear. Also some dry scabs in the scalp. Also having the lesion, we can see this under the lower lip, the pustular lesion that. Then the nose, in the nose, then on the right cheek. Okay. Also we can see on the parietal region. Okay, then see the homeopathy, the beauty of homeopathy is in the observation. Okay, so what we have observed? So we have observed the eruption of the scalp, but what kind of eruption? These are the pustular eruption. And what kind of discharge? It is yellowish, thick, and offensive. And also the patient having the bilateral tonsillitis. And I have also observed that small white pustular lesion on the tonsil that we call the suppurative tonsillitis. Head and face pustular lesion, head, the scabs are there, and the face, the pustules, the thick white discharge in the lesion. Then, so this is a case of a boy having the recurrent tonsillitis and suppuration in the scalp. These eruptions are for the last 3 to 4 days. The pus is offensive, yellowish, and thick. Some crust are there in head. The itching in the throat and small white pustular lesion in the throat, in the tonsil. So, also this child cannot tolerate the heat and wants fanning in all the seasons, even in the winter. Also, he cannot tolerate the appetite. He becomes tired very easily. Having tonsils for the last 1 year and which are aggravated by change of weather. And last year had a pus in the tonsil and also the high grade fever because of it. So when there is pus, there is high grade fever. There is a pain and soreness in the throat. Also aggravated in the cold weather, winter, taking cold food and ice cream. So this pain in the throat, the tonsils which are aggravated in cold weather and taking the cold food. And sometimes patient has a fever because of this infection. So this is very, very important. When the patient is having pus in the body, the pus in the organ, and because of pus, patient gets the fever. So at that time, we have to think about the homeopathic antibiotic remedy. I will tell you later. Also, patient having a fear of the ghost and cannot live alone in the house. And during sleep, he has a fear of ghost and he covers whole the body because of the fear that ghost is coming near to him. Other symptoms, the hobbies interest, fond of watches, and he has 3 variety of watches. These are for new clothes, okay? But what kind of clothes? Which looks the unique. Also the fonts of belts and goggles. And wherever and whatever he wants, he always take 2, 3. That means not a single one. If he wants the goggles, then Papa, I would like to take 3 goggles. Okay, so these are more than his desire. And during sleep, he removes the shirts and wants the fanning fast. तो जब सोता है तो पूरा शर्ट निकाल देता है, पापा मेरे को बहुत गर्मी लगती है, ऐसे शर्ट निकाल के सो जाता है. Also the past history of recurring tonsillitis and the boils, and also the fever from the pustular lesions. So the analysis of the case. So what is important in this case is that this boy is having the suppurative pathology, that is a suppurative tonsillitis and recurrent boils and the pustular lesion in the scalp. So we should think about the remedy which is pustular in nature, means a suppurative remedy which is having a thick yellow offensive pus with the other totality. And other symptoms of the case, the tonsillitis which is aggravated in winter, also aggravated cold food and ice cream, throat pain and soreness, also aggravated cold weather, and the general symptom cannot tolerate the heat, wants fanning fast even in the winter. That means the patient is hot, cannot tolerate the appetite. The mind symptoms, fear of ghost and fear of being alone. So when I put all these symptoms into the repertoire totality, okay, so these are the remedy: calcarea, silicia, sulfur, sepia, natrum, mure. Okay, these are the remedy. But remember, the repertoire totality will give us the group of the remedies. So out of the group of the remedy, we have to understand the case, we have to understand the pathology, and we have to understand the peculiar, the characteristic of that symptoms in that pathology. Okay. So out of these remedies, okay, I choose a remedy that is Calcarea sulf. Okay, and in the Murphy repertory, it is written that clinical wounds, general cuts, suppuration with thick yellow matter, Calcarea sulf. That was, so what does it mean? Whatever may be the complaint, whatever may be the causative factor, but the discharge, the pus, it that should be thick and yellow. Okay, so the suppurative tendency with thick yellow discharge. Okay, so I prescribe Calcarea 200 BD for 2 days, followed by SL BD for 15 days. And after 2 months, I prescribe Calcarea 1M. Okay, when latest follow-up, eruption disappear, boil disappear, and tonsil normal. So we can see what happened after the Calcarea 200. We can see that. See, initial this boy having the discharges are there, okay, but this child having the past history of suppuration. So after giving the Calcarea sulf, all the discharge, okay, gets dried, and it has created a scab. Okay, we can see that. We can also see that exteriorization. Okay, in previously it was small. Okay, we can see that all the pus dried. Yes. Okay, this is another follow-up. Okay, so the scabs that was dried, okay, it fell off. It fell off. Okay, then more clear than previous one. Okay, we can see the another thing. Follow up. This patient little dryness that pinna of the left ear. See, all the eruption, all the pustules, all the pus that's dried off, and it fell off. Only the black pigmentation was there. Okay. Okay, and last, okay, that pigmentation also went away. So these are the images 1, 2, 3, 4, 5, 6. So what happened after giving Calcarea sulf 200? The pus has dried, okay, but initially there was an aggravation after 200. Okay, so this was a case that I took in the initial years of my practice. Okay, but nowadays I am using the 50 millisiemens potency to for the betterment of the patient. That patient did not get any aggravation. Okay, so thank you, Swara team, for giving me opportunity to serve the homeopathic fraternity. Jai Hanuman, Jai Homeopathy. Thank you.
Jai Hanuman, Jai Homeopathy. Thank you, sir. So always your case inspires budding homeopaths like us. Thank you for this wonderful case, sir. Thank you so much.
Thank you, Banuji.
So we move to our next presenter, Dr. Meera Carol Javeri. She is from Gatkapur, Mumbai. Years of experience of practice, 28 years. Dr. Meera Javeri practicing genuine homeopathy since past 28 years in Mumbai. She had taken various homeopathy awareness seminars for laymen. She aspired to spread the light of homeopathy all over the world for the benefit of mankind. With this, I welcome you, madam.
So at the outset, I would like to extend my sincere appreciation to the Swara team for giving me an opportunity to present here on this platform. And I also congratulate the Swara team for the 100th SODP. Here, I would like to share the case of a 76-year-old female patient who visited my clinic in August 24 with a complaint of pitting edema, redness, warmth, tingling numbness, throbbing pain, and severe itching on both feet and legs, midway from calf to feet, aggravated by touch, standing for a long time, and better by bending the leg while lying down. She was prescribed many antibiotics without effect and was told that a complaint can't be helped. She then decided to try homeopathy. She's staying with her husband, son, daughter-in-law, and grandson. Daughter-in-law is too dominating. Patient says that she has to work like a newlywed. And she is not valued. She does all the household work, and even if she's fasting, she has to cook and do all the work all the time. So when daughter-in-law's father was unwell, her parents stayed with them for 1.5 months. She did everything for them, but still the daughter-in-law's mother fought with her. She will prepare daughter-in-law's son's tiffin. She feigns sickness. Daughter-in-law does not allow her to go anywhere with her siblings and says, who will do all the work if she goes out with her siblings? I'm sorry, there's some technical error. She says daughter-in-law does dadagiri on her, and she's living without any self-respect, and husband is heedless of all this. She doesn't like to stay there in that house, even if even daughter-in-law, even if daughter-in-law is very harsh, she will tell her very politely that I'm doing the work. Don't be harsh with me. Since the husband doesn't have money, they are staying in that house bought by her son. Otherwise, she says, otherwise, who will stay there? And my son also doesn't care about the daughter-in-law, how the daughter-in-law treats me. So then she goes into her past and also says that she was married since 22 years and she in a joint family where they used to stay with the in-laws in a very small 1 BHK. Mother-in-law did not allow them to go anywhere, even to the park, even after doing all the cooking, washing, everything. She says that daughter-in-law is like a snake. This patient is a very true believer in religion and said that the religion is my savior every time I have suffered big diseases. She feels that if she stays in this house and stays in these emotions, she will not be at peace, and her soul will not get a good. It is not good for her soul's welfare. She gives lots of religious exams, and she says that she has survived cancer because of her penance. She desires milk, buttermilk, and her acidity is better by cold milk. She dreams of snakes and also of sadhus abducting her and taking her to the jungle and locking her in a very small dark room, and there is no way out. She has a lot of fear in this situation. In delusion, she says that she sees snakes under the WC whenever she wakes up at night while passing urine. She has the past history of cocks in the eyes in 2018, cancer of the liver in 2018, for which she took chemotherapy and now she's fine. She has undergone appendicectomy as well as cholecystectomy, and she also suffers from piles off and on. So now, analyzing this case by Dr. Mahesh Gandhi's PEM method, it was very clear that this is an animal remedy and also that she is, her level of development suggested that she is a vertebrate. In vertebrates, I came to mammals considering the following characteristics: need to belong to a group and paying the price for that, conflict between whether to do what one feels like or to conform to the group rules, issues related to dominance or submission, deep feeling of being exploited and not valued by her mother-in-law as well as daughter-in-law. And considering that she submitted to all of these, I decided to give her lac de floretum. Also, according to Dr. Sankaran sir, Like the Floritum has the following themes: the need to belong, the fear of being rejected and being forsaken, tremendous sense of injustice, the feeling that they have to work very hard physically for others in order to be accepted by them, the feeling of having to bear silently a lot of suffering, and fear of closed spaces, which further confirmed my prescription. So I started her on Leg-Floritum and repeated the dose every 15 days for 3 to 4 months with some mild ameliorations, followed by 1M potency for a couple of months, but did not show the change that I expected. So I decided to revisit the case and observe the exact words that she had mentioned. She said that she had to prepare tiffin for her daughter-in-law's son and not as my grandson. A mammal has lots of affection for the family and they will not address the grandson as daughter-in-law's son. So it clarified that this is not a mammal remedy. She also mentioned that since her husband did not have money, she had to stay at her son's house. This is the feeling of being at a disadvantage and of being unfortunate. She was actually giving a feeling of having suffered wrong more than the feeling of being dominated. She said she had to work for her in-laws and she was not allowed in spite of working so hard. So this is the feeling of suffering injustice. The theme of religion, the delusion of snakes, the feeling that daughter-in-law is a snake, and the split of being dutiful on one hand and being suffered wrong on the other all pointed to the snake remedy. I also decided to repertorize the case, which gave Naja as a clear-cut simillimum. According to Dr. Rajan Sankaran, the feeling of Naja is often one of being neglected and wronged with much anger and malice, but at the same time, she may feel dutiful and responsible, and there is a constant conflict about this. According to Dr. Mahesh Gandhi, the theme of gaining knowledge comes under the inner age of adult and old age, which is evident in her giving religious exams even at this age, and Elapidae come under the adult and old age. Considering all these things, I prescribed her Naja 200. Her next follow-up after a week was a very satisfying one. Her edema, throbbing pain, itching, everything had settled. But it came back again, though in a lesser intensity. With 1M also, there was a similar situation. So then, this showed that the case was in the right direction, but the potency selection needed to be more accurate. So I decided to administer LM potency, and because of the following reasons: because of her pathology, her being an elderly patient, having low vitality, the chemotherapy aftermath, and also to avoid strong aggravation and to achieve a gentle cure. I gave her Naja LM2 daily dose, which showed gradual improvement and gradually stepped up to LM3 and LM4 as required. She was completely better after Naja LM4 in September 2025, and I decided to stop all the medicines. Till date, her complaint has not recurred, and she is very, very happy with the treatment. So this is the picture of her leg before starting the homeopathic treatment, especially Naja, the Lag-de-Floritum, and this is the swelling and redness of her legs, and she had intense throbbing pain along with it. The picture after she got treated is there, we can't see any swelling or redness. So this case shows the proximity and the remoteness of the mammalian and reptilian kingdoms, and how the two remedies like Defloritum and Naja come so close to each other and are still so different. It also shows how we can be misled if we do not pay complete attention to the exact expressions of the patient and get carried away by their story. It shows how fast the so-called incurable case can show results if the finer differences are understood well and each and every statement of the patient is considered closely. It also highlights the usefulness of LM potency in pathological cases. Thank you so much, everyone, for the patient hearing and bearing for this technical glitch.
Thank you so much, madam.
Yeah.
It was a nice presentation, and we come across beautiful remedies. Two remedies, lac, defloratum, and naja. We
Yes.
came across the themes and we can learn the themes from your case. Thank you for this wonderful case, madam.
Thank you so much. Have I stopped screen sharing?
Yes, stop.
Yeah.
For lot of things are we are going to learn. We have learned from these cases, and with this, I I introduce next speaker, Dr. Ashish Saparia, sir. He is practicing as a homeopathic consultant at Dr. Saparia's Homeopathic Clinic at Gondal since 7 years. He completed BHMS and MD from Anand Homeopathic Medical College and Research Institute, Anand, Gujarat. Experience of working in Government of Gujarat as a medical officer for five years. Teaching Materia Medica since last 7 years at Sri V.G. Garaiya Homeopathic Medical College, Rajkot, as Associate Professor in Materia Medica Department. He also has extensive experience of working in multiple hospitals in emergency and ICU for 12 years. With this introduction, I welcome you, sir.
First of all, I would like to congratulate and thank the whole Swara team for these completing 100 SODP sessions and arranging such a beautiful competition so that we can learn, we can see the practice across the country, and we can learn from different participants, different practitioners, different way of practice, different way of prescribing. So thank you very much. So let us start with the case. Who has a diagnosis of ulcerative colitis? He started the complaints in 2016, but initially it was on and off diarrhea and abdominal pain, and he consulted local doctors, and then in 2017 he was diagnosed as ulcerative colitis. So his chief complaints were multiple time stools during the 8 to 10 times frequency per day, stool mixed with mucus and blood, sometimes frank blood, severe left-sided abdominal pain, excessive flatulence, weight loss with severe weakness, sleeplessness with anxiety, and depressed feeling, fear with anticipatory anxiety. So he consulted many allopathic doctors, colonoscopies were done, multiple treatments were taken. Then there was no permanent result. Then he shifted to Ayurveda. But in Ayurveda, they have many restrictions in food, and he started losing weight. And he was fed up with the treatment that I cannot eat these, I cannot do this, and I am losing weight and not getting cured. And even the diarrhea was the same. So there was no any result anywhere. And then he consulted me in September 2024. So I asked about depression and tension. So cannot concentrate on my work, constantly thinking about my illness. I'm always stressed. I cannot feel stress-free. Always irritable if anyone asks me anything or talks with me. Always I am thinking that when I will get cured. I want to get cured very fast. I can't, because of this complaint, I can't leave the town. I cannot go anywhere. I cannot attend any social function or any marriage function, and I get disturbed. Even I got married late as I have this problem. So I don't feel free. I feel restricted. The bandhan word he used in the vernacular Gujarati language, that as if I am in a bandhan. I want to change my job. I get good offers, but I cannot change because of this illness. I feel I am stuck. I feel helpless. How does life seems like? So life feels like I am in a jail, as if a parrot in a golden cage. A parrot gets everything in that cage, but his life is limited in a zone. He can't go out of that zone. So this came with the hand gestures and energy. So I asked, limited in a zone means restricted, constricted. We cannot live in the outside world. As for example, I am married now for since last 6-7 months, but I have not gone to honeymoon. I cannot go to honeymoon because of my complaint. I constantly thinking what will happen if I go outside, whether there will be toilet there or not, whether I will get this sudden urge, and I constantly get this kind of thoughts, and I cannot go anywhere. So how does that feel like in that zone? It is uncomfortable. Uncomfortable means not comfortable with my body. In young age, we have thought when we grow up, we will do this, we will do that, but I can't. I could not go in the department I wanted. I can't leave my job. Even if you don't like the work, still you have to do it. Even though you are not comfortable, still you have to do it. That is uncomfortable for me. The things you wanted, but you don't get it. You cannot be free. So I asked, what is comfortable or free? So whatever I want, I can do. I don't need to think. I can take decisions quickly. Complete free. Good job, good salary. I can go anywhere I want. So I asked, what kind of job you want? Because he said good salary, good job. So he said, good salary, good future. Right now, I feel like that parrot, which is in that cage. They are taking advantage of me. They use me because of my health. I feel restricted, which is again coming with the hand gesture. So restricted in that zone. एक zone में बंध गए हम लोग. वो बंधन है हमारे आजू बाजू. So restriction meaning restricted in responsibilities, bonded with someone. So I asked about responsibility. I have to do my work in the office. I take more responsibilities than my boss. I have passion, कीड़ा, and this came with a lot of energy. मेरे अंदर एक कीड़ा है कुछ नया सीखने का, कुछ नया करने का. So I have that passion to learn new things since childhood. I want to go deeper into any subject I learn. I want to get solution of the things. I feel that I have done it. So I asked, new things means that is self-development. Like everyone does their job, but I think how to make improvement in the work, in that job, how to get solution in a very simple way. I want to do smart work. As for example, if a task is done in 1 hour, how we can do it in less time with better results. And then my mind becomes restless and constantly changing and thinking different things about that solution, about that work. So I asked about solution and result. As I do accounting, in accounting, if data matches, then it's result. So I asked, then what is new in that? It is everyone does that. So the way I put the data and formula in Excel sheet, that it matches every month and I don't need to rematch every time. I wanted to go into the IT field, but now I have come into this GST and accounting field. This is also he mentioned before that I'm not able to go into the department I wanted. So as always Shekhar sir says, तुम्हारी चाहत ही तुम्हारा नशा है और जो तुम्हारा नशा है वही तुम हो. So his चाहत was going into the IT field. So I asked, why IT? So he said, I have this passion, kida, in me to learn new things. I want to do something new. I want to do something different, do smart work. We can use technology, we can use software, etc., etc. Even I tried in police also, but because of my physical complaint, I could not crack it. I think my future is limited. I want to get out fast. I want to go to my comfort zone. How does it feel like in this situation? I have a feeling that I will get sudden pressure for toilet. Right now, then I asked, what about the fears? Right now, fear of my health. I want to get new job, new task, but I have fear that I will not be able to do because of my illness. Any other fears in general? That is crowd, traffic. I just want to get out of there. Hobbies are trekking, mountaineering. I used to do that, but now I cannot. Now I don't feel free that, yes, I can go there. So right now I have a feeling that I cannot do this kind of things. So initially, the case is almost 1.5 years long. So I cannot tell everything in this short time period. But initially it looked like animal. They use me. They take advantage of me. Even the the super class 3 themes that I cannot do things on my own. My health restricts me. And the theme of like bird theme in a cage, restriction, bandhan, everything came. But her main thing was he is not able to do what he wanted to do. He is not able to get the job, not travel, cannot go wherever he wants. Things he wants, but he not getting, cannot take decisions. This suggests the incapacity or mineral kingdom. For such kingdom, we have 2 things. In one part, he constantly talk about stuck, helpless, in the jail, parrot in a cage, in the limited zone, restricted, constricted, uncomfortable, cannot take decisions quickly, not free, get out fast. So this suggests nitrogen. And on the other side, he said learning new things, new tasks, result, solutions, self-development, something different, smart work, technology, software, which is suggesting row 5, argentum. And this is the repertorial totality: mind anxiety, abdominal complaints about, mind escape, desire to, and all those rubrics which also suggested argentum nitricum. From Dr. Rajan Shankaran sir's Soul of Remedies, if we read it, it is mineral remedy belonging to psychotic, tubercular, and cancer miasm. So in these case, it is also there that he started taking responsibility of his family since a very young age. So it is very much near to tubercular or cancer miasm. But he has mentioned clearly in this book that this situation arose from being trapped alone. So the feeling even in argentum is being trapped. What he was talking about, being in a jail, being in a cage. So this trapped feeling is not only in the birds, but it can be found in this argentum nitricum also. And trying desperately to find a way out. There is tremendous sense of fault within, that my body is weak, or because of my illness, I cannot do this, I cannot go out there. So this tremendous sense of fault within is there in this case also. So in whichever situation, when he feels is trapped, and all the complaints of argentums are aggravated. Like he said that whenever this situation comes, I feel that I have to pass the stool. And they can act impulsively to get out of this trap. There is no way out, or I don't see the way out. Such a situation could be crowds, which was a fear in this patient, crowds, traffic, etc. And there is a feeling of crisis manager. What he said, I take more responsibility than my boss. I have to manage things. I have to get solutions. So they are troubleshooters of the highest degree and see their role as that. Feeling very much neglected or isolated, and feeling of failure if they can't perform in a crisis situation. So the prescription was argentum nitricum 1 mg for 15 days. As the pathology was very severe and he had severe diarrhea, and the delusions were very clear in the case. This case was directly at the delusion level, that I am in a bandhan, I am in a jail, I am in the cage. So many delusions he gave. So that is why I choose 1M potency. And because of the illness, I wanted to repeat, but I don't have that LM potency at that time. So I started with 1M BD. And then after 45 days, I have many follow-ups, but I have just mentioned a few. Only after 1.5 months, only 3-4 stools per day, mucus significantly reduced, blood significantly reduced, flatulence is still there. But no anxiety, no persistent thoughts of disease or future. Now I don't feel that tired mentally. Otherwise, I used to feel very tired mentally.
But
I feel relaxed now. So I was planning to buy a house since long, but could not. After this medicine, just in one instance, I bought the house. So उसने कहा एक झटके में मैंने घर खरीद लिया, पहले मैं नहीं खरीद पाता. So I have long follow-ups, and after 1 year, no any issue at all. Now can eat all outside food without any trouble, and he has totally gained 9 kgs of weight in 1 year of treatment. And now he is also in touch. He frequently meets me, but there is no need of any treatment, and he is absolutely fine. So thank you very much. Thank you, Swara team, Shekhar sir, whole the Swara team, Dr. Divya ma'am, Dr. Priyanka ma'am, Bhanu sir, everyone. Because of the type of case study I learned at Swara Gurukul in the 2024, I could crack this case, and I could ask certain questions to clear my doubts. So thank you very much, Shekhar sir and team Swara. Thank you.
Thank you so much, sir. Yes, we can see all the themes of trap, limited, but I can recollect the way Shekhar sir has differentiated the superclass theme of 5 and superclass theme of 3. I think this information has helped us. So I
Absolutely.
can recollect in your case. So this is a superclass also helps us in clarifying the remedies and everything. So I suggest everyone to participate or enroll yourself in upcoming workshop. that is super
Because
class 4.
in this case, there were many issues which would tempt you to go towards superclass 3.
Yes.
The main theme was restricted by my own weakness, which is a superclass 3. But when patient brought up this issue of new things and responsibilities and all those things, then it didn't came into the superclass 3. So I went to superclass 5 because he wanted to get out fast. This fast theme was very much present in the case.
Yes. Thank you so much, sir.
Thank you.
So with this, our next presenter is Dr. E. Tharasubha ma'am. She is from Tiruvallur, Tamil Nadu. Years of experience of practice is 12 years. She completed BHMS in Swara Homeopathic Medical College, Salem. In 2012, worked as a homeopathic consultant at Priyam Clinic in Chennai for 4 years. Now practicing homeopathy in the name of Vagai Homeopathic Clinic in Tiruvallur, Tamil Nadu since 2017. With its introduction, I welcome you, madam.
This is a very happy, immense pleasure giving opportunity to me to attending this 100th SDOP session. So here I presenting my case as of an anal fistula. So the case goes on. This is actually post-fistulectomy management. So after the fistulectomy treatment, how the patient was suffered and how homeopathy helped for her. This is a case of 21-year-old female. She came with a complaint of pustular discharge in the anal region with intense pain, especially at the post-operated fistula, that area. Bloody pustular discharge with external fistulas opening. Fear regarding the recurrence and healing, intense pain. She came with a very intense pain. So she is actually one of my patient's daughter. Her mother taking treatment for me for diabetes and hypothyroidism. From the childhood itself, the child repeatedly getting gastritis, diarrhea, vomiting, these kind of episodes. More than 10 times she got admitted in hospital, getting IV fluids like that. Every time acute attack comes now, she will go to the allopathy hospital and getting 1 day or 2 days administration like that. Her life goes on from the childhood. And for me also, she came for acute gastritis in the time of October 22. That time she was managed with the sulfur. And Jan 2023, she managed with an Oxomica. And again, Jan 2025, she came for the same complaint of gastritis, diarrhea like that. That time she was managed with the Phosphorus. And last year, September, she had a very big perianal abscess. For that, she went for IND. So nearly she suffered 2 weeks with this abscess. After that, she went for the IND. Again, she developed the same kind of complaints, so that a big swelling at that perianal area with the abscess and swelling and intense pain. So near early month of December 2025, her mother called me through phone and told about all her complaints. She is in severe pain. She need at least some palliative medicine like that. So that time I suggested only Bell. Bell reacted well for her nearly 2 weeks. She was okay with the pain, absolutely no pain actually. Like that, again the scenario goes on. And the end of the December, she got a severe pain, severe anal, perianal abscess, swelling, everything. Again, she came to the allopathy hospital and there go through the MRI. They find out the grade 4 extrasphincteric fistula. So immediately they operated. In the Jan 7, she had undergone the fistulectomy. And Jan 10, she came for the consultation with the severe pain and again with the pustular discharge. So this is the MRI report. The next slide. They will show off the fistula's position. This is the internal opening side. This is the external opening side. This is the total length. It's nearly 7 mm. 54 mm length and 7 mm in the thickness. This kind of lesion, this fistula is, she was affected. This is a discharge summary of her. So what is the physical genders here? The chronic suppuration tendency, post-surgical fistula discharge, severe pain, mild touch also giving a more severe pain for her, recurrent GI disturbances from the childhood, irregular menses with a dysmenorrhea, that is also her chronic complaint from the childhood. So this is the own words from the patient. From childhood, my family suffered for money. I want to support my family with the money. Past 8 months only I started to work. For the sake of health, my work life suffers. I don't like to always go for bathroom and check for the pustular discharge and clean it. Literally, I'm cleaning more than 8 times in office. Otherwise, it will spoil my dress. I don't want to take leave on my work. I want to work well. The last few months, I had taken many permissions for the sake of health issues. I feel for that because my team and manager will think I'm not doing my work. They will give a bad name for me. In office, no one knows about my health issues. I don't want the sick image in front of them. Even I'm eating healthy foods, avoiding junk foods, I suffer with repeated stomach pain, diarrhea from childhood, now this complaint. When I was on a surgery table, one doctor gave pathetic reactions as "Cho, pity girl," like that. One doctor told to another doctor. That doctor asked, why you are telling like this, doctor? The doctor said that she was suffering with this kind of disease in a very young age. It's made me cry on the table itself. I don't want these things. And she told and cried. And anybody in the home advising about my health, literally I become angry and shouting them because I'm eating carefully, doing things on my best, but I'm suffering. Any relatives giving advice me, I'm getting anger, but not able to show off to them. They are creating sick name to me. I don't like it. I'm having too much fear about my condition, able to cure or not, if it will worsen. After finishing the surgery, the doctor told it will recur. Since that, I am feeling more fear. From the surgery itself, I am feeling severe pain. The pus is coming continuously. Then why they made surgery? I need relief. I want to free from all the health issues. I don't want to be sick. These are the words from the patient. So from this, the mental generals from the core essence, intense fear about health and the recurrence of the disease, aversion to pity, aversion to being labeled as a sick, responsibility towards family, anxiety about career and performance, anger when advised about health, suppressed emotions with the silent suffering, hiding her sickness from in front of others, desire to be strong and independent. So based on this, the kingdom goes for mineral predominance. The core sensation, the responsibility theme, the fear of breakdown of health structure, endurance despite suffering, desire to remain strong despite pathology, structural pathology, that is fistulous tract, deep chronic disease process, survival and stability concerns, financially and healthy, endurance and performance pressure. Here there is no plant sensitivity issues and animal, no competition on jealousy themes, you versus me themes like that is not presented here. So here the dominant miasm is psychosyphilitic, the suppuration, abscess, fistula, recurrence, hiding, everything goes under psychosis. In the syphilitic, deep tissue involvement, chronic destructive pathology, it comes under syphilitic. In Swara, anxiety about health, fear of incurability, it comes under Swara. So repertorial totality, mind, anxiety about health, mind, fear, disease of incurable, mind, sensitive to pity, rectum, fistula, anus, general suppuration tendency, mind, responsibility, duty conscious, mind, anxiety about disease, sensitive to remarks, mind, sensitive to criticism. So for remedy differentiation, Calculi silicata for responsibility, fear and deep suppuration, Silesia for pure suppuration, timidity, chilly, lack stamina, Calculi card for fearful, insecure, sluggish constitution. So I selected the remedy Calculi silicata 1 Usually I will give in a water drops, 1 drop of medicine in and 3 drops of dispensing alcohol mixed with 100 ml of water. From that, I will ask the patient to take 5 ml 3 times per day. So it will goes on for a week. Like that, I will give a 1 month course. So the follow-up on that 2nd February, the first consultation on the 10th Jan. So 2nd February, she came for the follow-up. 90% reduction in the pain, 80% reductions in the discharge, no bleeding, improved confidence, mood stable and passive. In that period, the menses came normal without any pain. So this is the before-after pictures. This is on the 10th Jan. immediately after the surgery finishing of that time. Like 7th of Jan, she had the fistulectomy surgery. The 10th Jan, this is the picture. This is the serial picture. Every 1 or 10 days within the gap like that, it was taken. Here we can see this opening is started to close well. Again, she had an acute episode of severe throat pain with fever, cough and cold on the 17th February. Again, she was managed with the Calculi silicate water dose. Again, everything is resolved within the day itself. This is a current status. So significant reduction in the fistula symptoms, pain minimally is very, very mild. That is also on pressure, not in touch actually. Discharge greatly reduced. Mental state confident and calm. Overall improvement is in general health. So here the deep acting constitutional remedy showed a marked improvement. So post-surgical separation reduction completely happened. So mental, physical, general, everything is improved. She is happy now. So thank you, sir. Thank you, Swara Gurukul team, for this great opportunity to give me to present this case, especially for the Shekhar sir, because last time only I attended the workshop. This is the first workshop for me. There only I able to find out the two sides of salt. Before that, I don't see. Even the patient is telling in front of me, I can't able to find out the salt. Only one side of salt only I am seeing. I am giving that one side of salt only. That giving 50% improvement. After that, the case will stop there. So after attending the Gurukul only, I can able to see the two sides of the salts. Then only this is because of SAR only I can able to manage this case with a short period. Very, very much improvement in her case. It's giving me very pleasure. So special thanks to Dr. Shekhar sir. Thank you.
Thank you so much, madam. Yes, rightly you have said that lot of time we miss many cases when we don't know about these salts, two sides of salt, when two remedies are coming closer. So we have pen drive regarding these salts also. If anyone want, they can keep order for these salts. So thank you for your presentation, and we can learn that how we can manage post-surgical cases also when we prescribe correct remedy. Thank you so much. So now I welcome our next presenter, Dr. Kirti Mutreja, madam. She is from Mumbai. Years of experience of practice is 20 years. Dr. Kirti ma'am, she completed BHMS, MD, FS, PC, MCAH, CIM. Certification in Cognitive Fitness, Harvard Medical School. Dr. Kirti Mutreja is distinguished homeopathic physician and psychiatrist with over 20 years of clinical experience in managing psychiatric and pathological cases across OPD and IPD settings. Her core expertise, psychiatry and psychosomatic disorders, pediatrics, allergies, GI disorders, and dermatology. Special interest, neurology, integrative oncology, renal, hepatic disorders, hormonal and lifestyle diseases reversal, with a focused approach towards the psycho-neuro-endo-immunological axis and epigenetic influences. She has achieved notable success in successfully treating psychogenic, allergic, hormonal, and other non-communicable diseases. Professional contributions are established and led rural homeopathic mobile clinics near Mumbai, successfully ran a dedicated homeopathic pediatric OPD, regular speaker at mental health and preventive health awareness programs for hospitals and corporates, mentor and educator for homeopaths through seminars, workshops, online platforms, and clinical training. Research and publications, she authored 12 publications in reputed national and international peer-reviewed journals and reviews research papers for esteemed journals. With this introduction, I welcome you, madam.
Thank you so much, Dr. Bhanu.
Yes, thank you, ma'am.
Thank you. Yes. So very good afternoon to everyone. Thank you so much to the Swara team for this Swara online digital portal through which we are able to get continued education and share and learn so much. So now I'll start my today's presentation. So today I'll be presenting a case of psoriasis in a 41-year-old male. So here what we saw in this case was that he had the typical presentation of psoriasis with patches on the arms near elbows. Just last year only in May it started, and then he also told about his diabetes since 5 years, and also he had a history of recurrent URTI. He had cold and that affected and caused a fever also. So when we asked about the history of the presenting complaint, so what this patient had was that since 5 to 6 months the psoriasis had started developing and it was increasing, and there was intense itching was worse at night and after scratching, and there was excessive scaling. So all the typical clinical symptoms of psoriasis. There was nothing very peculiar in the presenting complaint. And the effect of this chief complaint on the patient was that he said that people judge me. I avoid going to office and work from home because they look at me and I feel very conscious about it. And also he had a tremendous anxiety of health, fear of complication. Doctor, will that cause a psoriatic arthropathy? Some people told me if I have joint pain, it can be because of psoriasis. I can have arthritis. So all this anxiety was there, and at the same time he had a relationship, he had a fear that it may affect his personal relationship with the wife. Then asking about the diabetes, he said that during COVID it started. Initially he said that, that time it was like work from home, so lockdown, no physical activity, lot of food. So that is why it increased. But later part of the case, when I probed further that what were the stressors during the lockdown, then he told that the main issue was that his salary had been stopped by the office. And he did not even tell about it to his family, neither wife nor parents, because he had a lot of anxiety that if I tell, they will be more anxious. So he had a lot of frustration and anxiety about finances, about everything, but he was not sharing it with the family. And all these thoughts might have led to his diabetes. Also, he had allergic rhinitis since childhood. In the morning he had sneezing, as at the same time after dust exposure. And also he complained of recurrent headaches whenever he is stressed. He said that it's usually in the left temporal area, and the headaches, they start in the morning around 9 a.m. and by before noon, 11:30 or by noon, it stops. And it's more in the sun and it's more in sitting. The characteristic modality was, he said that I cannot sit. I have to be active. I have to keep on walking. When I walk, my headache is better. If I sit, the headache increases, and definitely the anxiety or stress triggers the headache. Then otherwise, when asked about his stressful situations, because that is where we get the main gist of the patient. So initially he was talking about the common work pressure, health anxiety, panic response. Whenever his sugar levels increase, anything increases, so he gets a lot of anxiety. But when asked further deeper, then he said that the main stressful situation in his life was when his father was diagnosed with cancer. So he said that was something that really stressed me a lot, and that trauma is still affecting me. And if anything happens, if my sugar level goes high, or if I'm diagnosed with any disease or any symptom, then I just start getting all the investigations that is the cancer hereditary? Will I also develop that? Why? Because he said my father was so very healthy and fit. Still he got that disease. So, and the pain of losing my father was so much for me. I'm so attached to my family, my father, my mother, and so I don't want my wife and my daughter also to suffer the same thing that I suffered. So what is the deepest experience in this fear was that what if my family loses me, or what if I lose my family? So the separation from loved ones was unthinkable for him. And also he had that subtly he told that doctor, like, now with psoriasis, my personal life with my wife is getting disturbed. What if she stops loving me and she leaves me? So that is also something very unthinkable for me, because I can't live without her. I depend on her. And depend for what? For love, emotional attachment, for care for daughter. So then asking about the basic nature of the patient, what he told is that he's very shy and reserved, a family man, emotionally very attached, and at the same time, any thought of being separated from the family was most painful for him. And he told that I'm a very introverted person, doctor. I don't express myself at all. And then asking more and more about his nature, it is here that he told that I'm so reserved, doctor, that even not having any salary, just on the brink of losing my job during COVID was such a stressful thing, but I never told this to my mother or my wife about it because I was so much anxious that this will trouble them, this will cause them anxiety and stress. And he desired solitude, and in the physical genres, mainly he had intermittent constipation with hard stools and a past history of acne on the face. And also he had lots and lots of warts on the neck. All around the neck he had lots of fleshy soft warts and also premature graying of hair, and the itchy red patches on the abdomen. They were aggravated by walking. He said that whenever I walk, I itch more or scratch more on my abdomen. So a headache which is better by walking and aggravated by sitting, but a itching that is aggravated by walking. So these were the characteristic symptoms other than the regular psoriasis symptoms. In the hobbies and interests, the patient says nothing particular, just spending time with family, sitting alone in peace. When I'm stressed, then I don't want anyone. But otherwise, when I'm not stressed, then I love to spend time with my family. And he did not give any significant dreams. And so the patient came to me in July 25 with the typical psoriasis presentation. Elbows are the first affected, and also his entire scalp and the head had the psoriasis lesions. So now what is it that we prescribe? So considering this case and then analyzing it from all the 5 fingers, I mean, if we just look at one aspect, then sometimes the anxiety of health was so very prominent that we may get diverted to some remedy for anxiety of health. But looking at the patient from all angles, from proper circumspection, taking all the 5 fingers, then I analyzed the case and prescribed a remedy. And I was confident about my prescription, but I think I'll just wait for some time and then tell you the prescription, because after the prescription, the patient's condition started improving and the itching was initially not less. Initially, the itching and the scaling continued, but the lesions started improving, and also the pain in the feet. He started complaining of some pain in the elbows, then that pain reduced. So whatever symptoms started coming, they were improving. So he took treatment for a period of maybe 1 month or 1.5 months. And after that, what happened? There was a critical turning point. The patient just discontinued treatment. He was coming every fortnight for a follow-up, but then suddenly he did not come. And after maybe 5 weeks or a month and a half, he came with a full-blown psoriasis. He said, "Doctor, I'm sorry, I just had to leave the treatment." Why? This is the condition. That's how he came. His neck, his arms, back, the whole body was full of full-blown psoriatic lesions. And he said that what happened, doctor, was that I wanted to continue your treatment, but my mother insisted that I should first go for a dermat, get the psoriasis healed, and then for prevention I should come to homeopathy. And so, doctor, now I can't say no to my mother. So I obeyed her, but now this is the condition. So then I and my wife decided that no, we have to continue homeopathy only. So now such instances also help us to think about the patient. So what is it that we are learning about the patient from this? We see that he has a difficulty in asserting his choices. He is yielding and people pleasing. So what do? Do we antidote it? Do we give some intercurrent, or do we give a constitutional remedy? So definitely we go for a constitutional remedy in this case by reassessing the totality. And so the 5 finger of the case, the analysis tells that in the superclass understanding, this patient is definitely a left-sided. He's very mild, yielding, attached to family, and reserved and introverted. So it can be first, second, or third superclass. It cannot be fourth and more. The kingdom was very much likely to be a mineral kingdom. Miasm was a very clear-cut psychotic, excessive anticipation, anxiety, and acceptance and avoidance. And with the characteristics of the mind, skin, and the warts, the repertorization was done, and we got all the remedies: calcarea, arsenic, thuja, pulsatilla, sulfur, and natramur. But the keynotes are always pointing to the to Natromure in this case. So Natromure, now I gave not just 200. Earlier I had given him Natromure 200 single dose, but now I knew that it was such a blown up thing that we needed to repeat it in LM potency daily. And after that, there was steady improvement. The face, neck, everything, this lesion just started improving like anything. Within 1.5 months, the entire back, the entire skin was totally cured. There was complete resolution, and the improvement was not only in the physical symptoms but also the mental anxiety. And the warts also started falling. And if I have time, I have a very short follow-up of the case, and also the material medic of the Natromure we can all understand. Should I share a follow-up, Bhanu, or?
Time up, madam.
Okay, no problem. So the material medic of Natromure we all know. So with this, I like to conclude by saying that I'm very, very grateful to Shekhar sir and Priyanka ma'am and entire Swara team, because we are able to see the case in totality, not just because first seeing the case, any of my assistant was like, oh, it should be a case of arsenic or a calcarea carb, but only when we see the patient as a whole, his basic nature, his basic thing, even if the patient did not go into any delusion or any sensation, we could still hit the right remedy with the 5-finger method and get a lasting and complete cure. Thank you so much.
Thank you, ma'am. So it was nice presentation. Whenever I see your case, one thing I learn is how to get sure shot with 5 fingers. You will be always searching for sure shot remedy with application of this 5 superclass, kingdom, miasm, characteristics, and keynote. So thank you for this presentation, madam.
Thank you so much.
Our next presenter is Dr. Kamlesh Kakde, sir. BHMS MD, PhD scholar. Is a clinician, researcher, and educator based in Nagpur, India. Specialization in the homeopathic management of neurological and complex chronic disorders. He serves as secretary of Ask Health Foundation, where he leads research-driven clinical programs and community neuro-wellness initiatives. Dr. Kakde's research focuses on developing structured, evidence-based homeopathic treatment protocols for dystonia, epilepsy, movement disorders, and neurodevelopmental disorders. His scientific work has received international recognition, including the Innovative Researcher of the Year award by Scientific Laurels, where his research profile and contributions are listed on the global platforms. Alongside his clinical and research work, Dr. Kamlesh Kakde is an active teacher on various national and international platforms, delivering lectures, case discussion, and academic sessions on homeopathic philosophy, clinical reasoning, neurological cases, case management. His ongoing work aims to strengthen outcome-based evidence in homeopathy and advance its role in holistic neuro rehabilitations. With this introduction, I welcome you, sir.
Thank you, Dr. Bhanu.
Thank you,
And
sir.
let me take a moment to congratulate and thank Team Swara and Dr. Shekhar sir for such a wonderful organization. And today's case is of 15 years young girl visited for generalized anxiety disorder. So we asked for the concern she had, and she said that I have hair fall, continuous watering of left eye, and I'm having mind blocks. So this mind blocks is very interesting. So we asked about what is mind blocks and describe the mind blocks. And she said that mind blocks means nothing is going on into my brain, and I keep on working blankly without any thoughts. And so what is the experience of this mind block? It is very exhausting for me. It's as if working like a bull, moving in a circle without any result. I try to distract myself by working more, like by learning something or by doing my assignment. I think it will make me feel better, but it doesn't. Then I just keep on working mindlessly, but then I feel more weight and days. So what is unexpected here is weight and days. So we ask about weight and what is weight and days, because it is sensation of the case. I feel heavier Heavy means something weighted. I feel like I'm being pulled down. Describe pull down, unrelated to you. So pull down means someone is pulling down something, and she did this type of hand gesture. Someone is pulling down something. So here patient is expressing hand gesture. So we ask about hand gesture because it is the energy of the case. So talk more about this action, like someone is pulling down so that something will sink. I feel like there is kind of emotional burden. So we asked that not related to you, just the word pulling down, because she was again going back to herself. But we want to disconnect patient from herself. So pulling down is just weighing something down so that it, and she took a pause. And then she again started explaining that pulling down is dragging down, grabbing something and just pulling down. And she again did the hand gesture and described this action. What do you mean by this? So patient added that it's like taking hold of something and dragging it down. It is like putting weight on that object, holding it and dragging it down, whatever it is. And even after repeated persistent interrogation, she was not going any further. So we decided to try wise process on the patient, and we showed this picture to her, and asked her to create a story, and she created a story like this. So she is a potter and she is going out of town. She sees a dog and decided to do something stupid and messes with the dog. She wanted to harass or tease the dog. She throws something towards the dog because she thinks it's fun. Like it's fun for some people. Dog's survival instinct kicked in and he jumped on her and ate her alive. So what is happening here? So dog jumped on her and ate her alive, but this is not a nature of dog. So what she's talking about, and the jump is like a leap, elongated jump. Again, this is not a nature of a dog, but she's talking something completely nonsense. In agitation and to save himself, dog attacked her, just ripping her into the shreds. So ripping into the shreds, again, it is not the nature of the dog. So we need to think what it is. It must fit with the medicine. What is the experience there? Experience is of sheer pain, regret and fear. I feel heaviness of the head, profuse sweating around the neck, dryness in the throat, intense discomfort. So these are physical sensations of this delusion and experience. This discomfort feels like to be dazed, helpless. It's as if I have sunk to the bottom of swimming pool. I am suffocating and trying to save myself by trying to swim to the surface because I want to survive. What are you most sensitive to? I'm sensitive to relationships with the people. I put efforts in the friendship and I expect them to put some efforts too. If they don't, then it disappoints me. So she is sensitive for relationships and she also gets disappointment. I feel let down by that particular person. It is disappointing. I feel vulnerable to emotion. What is vulnerable? Vulnerable is something that's not too secure, which is insecure. It can break easily or hurt easily. What is opposite of this? Opposite is something that is secure and comfortable. And what is comfortable is safety. Safety feels like light. Light is airy, smooth going, effortless, like a feather. So again, heavy and light is coming again and again in every area. So talk about your nature. And she said that I am anxious person. When I get anxious about something, I start working mindlessly to distract myself, but I can neither concentrate on work nor on myself at that time. It feels like all for nothing. Talk more about this anxiety. I get restless at that time. I think about any fruitless work on any stupid embarrassing thing that I have done. I just overthink meaninglessly. If anyone remembers that, they will have certain opinions about me. They will judge me. And how that affects you? Many people judge me, but I want them to not have negative opinions about me. So she is sensitive about the opinions of other. It's not like I don't want them to leave me, but that negative energy will affect me in some ways. People spread rumors about me. Many friends have drifted apart due to that. It feels like they don't trust some random person over me. It feels like they would trust some random person over me. I can't build my trust on someone. it's disappointing to myself. I care about people around me. I have a small circle, but I trust them. I expect them to trust me, be by my side, have my back. And how does it feel to have someone at your back? It feels secure, and it is like, even if you mess up, they will be there, not to clean up your mess, but for support. How it supports? Support is emotional support, and it's like a comfort that this person will not leave you. And how it feels like, it feels like it's not my mistake. Because of my ego, I may blame them, so I blame myself that I must have done something. Why do you do that? Maybe it was my mistake. I think that I am taking responsibility of everything, but in fact it's just blaming myself. And what is the experience? I feel disappointed in myself, and I tried and worked on relationship, but it doesn't mean anything to them anymore. I feel hurt. I blame myself. Why don't you ask them? Confrontation gives me anxiety. I'm blaming myself, and they will be able to convince me that it's my mistake, and I would readily accept that it is my mistake. So she readily accept that it is her mistake. How does it that feel? I feel anxious, and it pulls me down. And again, about this anxiety hit rock bottom, as if you have held down. And what is the experience? The experience is of, I feel heavy. Again, heavy and light is coming. I have to force myself to work, kind of heavy. I want to just lay down for hours, but I can't do that, as I want to get my work done. And because of that, neither I get solitude, not that I want, nor I get my work done. And I feel disappointed in myself. When I have this heaviness, I have to force myself to work. And what is the opposite of that? Everything is happening smoothly. You feel content, like you are doing enough, you are getting your work done, there is no haze. How does that feel? I feel weighted. Again, the experience of weight is coming. I have this responsibility, my work, my studies are my priorities, but at that time I feel like a weight. It slows me down. I feel heavy, but I choose to do something. I feel emotional and heavy hearted. I can't process anything. I prefer solitude at that time, but I don't give that space to myself. I start working to distract myself from these emotions. She had perspiration around the neck and dreams she not remembered actually. So, how to analyze this case? And best way to analyze is considering five-finger method, which consists of superclass, kingdom, miasm, characteristic, and keynote. So, what is the superclass? She is talking about relationship, disappointment, opinion, judge, which indicates third row of third row of periodic table, which indicate third superclass. She's talking about trust, small, big, hold on tight, need to belong to, and this all things confirm, this dynamic confirms the third superclass. About kingdom, she's trying to save herself, trying to survive. Someone is doing something to other, victimized, harassed. So this indicates animal. And in third superclass, animal kingdom, we have birds and lac humanum. So, which is the exact prescription. So in this case, characteristic symptoms help a lot. So I consider these rubrics: back, perspiration, cervical region, mind, abstraction of mind, activity, desire for, escape, desire for, learning difficult, delusion, ostracized she is, and it indicates remedy, Heliatus leukocephalus. So this is Heliatus leukocephalus, and the source language we can also observe in this case is grab and pull, hold and drag, jump like a leap, elongated jump, eating prey alive, ripping into the shreds, heavy and light, airy. And this is Heliatus leukocephalus, and we can observe that how it hold and grab. And this is what patient was exactly explaining. And this is how Heliatus eats its prey, rip into the shreds. So we prescribe Heliatus leukocephalus 200 on 16th May 2024. And there are some cases which respond very well, and we actually don't need to do a lot of efforts in follow-up, because the recovery is very dramatic, and this is one of that case. We prescribe medicine and she started responding very well, and we need to just observe, keep on observing her improvement, and we have rarely repeated the remedy, and she started feeling relaxed, and the blankness has reduced a lot, hair fall has reduced a lot, and she recovered completely. And this is follow up after 1.5 year. I think time will not permit me to play the video, but in this video she has explained the whole journey, how she recovered, how she improved step by step, and after
Time up,
1.5 years she completely recovered. And yes, so this is from my side. Thank you so much for the chance to present the case. Thank you.
Thank you so much, sir. It was a good case. We can see that when we take right dynamic word in a case, when we pick up right dynamic word, it can lead to source level remedy. So the polarities comes very easily. The way case taking also becomes easier. So we can learn that from this case, sir. Thank you so much. So our next presenter is Dr. Sudhir Patil, sir. He's from Kolhapur, Maharashtra. Years of experience of practice is 12 years. Practicing classical homeopathy, interested in new learnings in sensation and synergy. So with this, I welcome you, sir.
Thank you. Good afternoon, all. And thank you, Shekhar sir and Team Swara, for giving me this opportunity to present my case. This is a case of male, 28 years, homeopathic doctor from Pune, Maharashtra. The consultation was done on phone. I asked him, "What is your problem?" He said he's having this tinea infection all over the body since many years. He tried various treatments, allopathic, etc., but no use. I said, "Talk more." He said, "I was in 4th year BHMS. I was in hostel with my friend. This infection started after a quarrel with that friend." I just noted that. It spread all over the body, severe itching in summer, and after undressing, it is more, and it is recurring. Then it has become dark and itching more. He was not telling much about the generalities, so I reverted back to the incidents. I asked him, "What was the incidents that you were telling?" To that he replied, "We were living in same room. We used to quarrel. I used to feel inconvenient." These are his own words. He always talk opposite. While talking with friends, he was taking advantage of me, like sharing my things, money, etc. He used to dominate me. I felt angry that time, but didn't show my anger. One afternoon, after the nap, he told me to bring something from outside. I denied and our quarrel started. I was so angry that time, I hit him. मैंने मारा उसको. During that time, I was shivering, voice was not good, and after some time, I cooled down. Dominated meaning, he never allowed me to go to any friend, etc. He took advantage of me. Advantage, उसका word चलता था. I felt inconvenient. Again the word inconvenient came. As if I am pushed in a corner. Anger was suppressed. Inconvenient. When I feel inconvenient, I don't feel like staying there. As if there is no air in that place. I didn't get you. What happens? I want to come out of that place. Inconvenient, not free. What is the feeling in that place? I have difficulty. Hello?
I request everyone to mute your mics.
I have difficulty in breathing in that place. Not only in this situation, but also in places like crowd, etc. I feel the same. He mentioned about Jatra. In village, there is gathering of many people. Where there are many people, he feel the same feeling there. What is the experience? I feel weak, anxiety inside, like what will happen? Same thing happened when he was telling the second incidence. Same thing happened when I was doing job in a hospital. One emergency came. My senior advised to handle the case in certain way. I didn't like that. I felt dominated by him. Again the word domination. I didn't answer him, but मैं वहां से चला गया. I went out of that place. When I was there in the hospital, it felt like inside a wall. I got stuck there. This was aha moment for me. As Shekhar sir has taught us. This was completely new. Means I was wondering where the wall is coming from. A wall कहाँ से आ गई? Describe stuck. 360 degree stuck. I can see the way through the wall, but नहीं हो रहा है. बाहर जाने को नहीं हो रहा है. My question was wrong. I should have asked about the wall. I asked about the stuck, but patient dragged me to the wall. He wanted to explain me about the wall. I get angry. I'm trying and trying, but in vain. Describe the wall. It is transparent. I can see through it, but I'm stuck there. Describe that wall. It is thin. I can see outside. It is not hard. And there was pause. Pause because I was hearing these kinds of words in my case taking for the first time. And this is the reason I wanted to present this case. Because at this moment of time, I was totally lost what to ask next. And as the wall has got some meaning, I decided to go with the wall. Describe that wall, color, texture, etc. It is light white. It is like water. If I put my hand on it, it sticks. It is smooth. It is smooth, but I am suffocating there. Describe the transparent smooth wall. It is flexible, but the air is not coming inside. Constrict ho gaya aisa. In Hindi, I am getting constricted there in English. I am hitting hard, but it stretches and it comes back to its original position. I am trying hard. Describe that wall a bit more. You're doing good. Thin layer jaisa. It doesn't break. It is stretchable and slippery, jelly-like. Describe that jelly-like. No way to come out. No air. I can see out but can't come out. So this was about constricted, stuck. So I wanted to explore the another side of stuck. So I asked, what is the opposite of stuck? Free, hawa jaisa, like no obstruction, like in air, open space. Somehow I went inside that jelly-like thing. What made you go there? I saw it's like a balloon and also free space through which I can see. Like a big balloon, clear and big, round shape. Very thin layer, I can see through it. This was repeatedly coming. I went inside, but I got stuck there. So stuck and freedom. Any dreams you get? Yes, dreams of nude girls coming towards me. And I experience, अच्छा नहीं लग रहा है. I don't feel good. I am feeling inconvenient. Again the inconvenient came. And I want to come out of that place. Leave me, like this. So the understanding of the case, my understanding of the case, superclass, innate dynamic of the case is to get out from the inconvenient situation or place. That is fifth superclass. Kingdom, I could see polarities like stuck and free, like plant, but also dominated, taken advantage, you versus me, like animal. So carnivorous plant was the subkingdom. Miasm, query tubercular, was not clear to me. He was trying hard and hard like that. Source quality is a balloon covered 360-degree, thin, transparent, sticky, attractive. Materia medica, skin, itching, aggravation, undressing and better rubbing from Fartex. And remedy given was Drosera rotundifolia 1 m, 3 doses in water for 1 day. Follow-up after 1 month, itching is still present. Boils are recurrent, which is his old complaint. Plan is to wait and no medicine. Second follow-up after 1.5 months, just 2 to 3 days back. It's very new case, but I will tell the reason why I presented the case. Itching reduced 40%. Eruptions are not increasing in size. Now having one boil in groin of the size of a peanut, not painful and recurrence is less. Mentally, he mentioned 40% better. I am less brooding, positivity is developing, and I am becoming more patient. I was restless previously. Appetite improving, and plan is no medicine. He is still under treatment, improving in all aspects. So I'm waiting, and this is very new, but I wanted to present this case as a token of gratitude to Shekhar sir. This is Drosera, and you can see the picture. These are the balloons or the wall or sticky things he was talking about. Thank you, Shekhar sir and Team Swara. Without you, this kind of case taking was impossible for me. 1.5 years back, I joined Gurukul workshop. My first workshop was of case taking, and after 12 years, I'm considering myself as a 1-year student of homeopathy. I can't thank you enough. Love you, sir. Thank you all for patiently listening to me. Thank you.
Thank you. Thank you so much, sir. We can see that your application of knowledge, what you have learned in Gurukul from Shekhar sir, we can see in this case, the way you took the case, it was very good. And thank you for presentation, sir.
Okay. Thank you. Thank you. Can I stop sharing?
Yes, sir. Yes, sir.
Thank you. Thank you.
So our next presenter is Dr. Preeti N. Jain. She is from Mumbai. Years of experience of practice is 28 years. Practicing classical homeopathy was the coordinator of the Homeopathic Study Circle Pune division. So with this, I welcome you, madam.
Fine. This is a case. Before I just start, I would just like to thank a few people. One is Dr. Rajan Shankaran, Dr. Mahesh Gandhi, Dr. Yakir for giving me this knowledge so that today I can present it to you, because for years I've been learning from them. And obviously, I would like to thank Dr. Shekhar Algundi and the Swara team for giving me a chance to present my case to you. Fine. This is a case of a 29-year-old male who is suffering from allergic asthma. The background is that this case was taken online. The patient's wife is an old patient of mine. So she knew what is homeopathy, and that is how the patient came to me. He had a complaint of breathlessness at night since 5 years. He was taking Montelukast, Cetirizine, Rota inhaler at times. Congestion of the chest, difficulty in breathing, noise while breathing, aggravated by dust, raw materials like iron and copper because he was working in a steel industry. His nature is he would get angry easily, short-tempered. If things don't go according to his wish, he gets angry, throws things in anger, but he doesn't break them. Loving and caring for his family. If anyone in the family is sick, he is worried about them. He was emotional, cries easily while watching movies, at times cries if he has a fight with his wife and he feels guilty about hurting her. He likes to help others. His hobbies were cricket, sports, fitness. He liked sketching, painting, trekking, liked to do commentary and anchoring. His ambition was he wanted to have a business of his own where he would have enough money so that he could, keep his family happy and meet their needs. Wants a good lifestyle, fears ghosts, traveling alone at night on the bike. If a snake comes suddenly, I said he had this hobbies cricket Ambition was he wanted to have his own business so that he has enough money for his family. He can keep them happy. He can, meet their needs. He wanted a good lifestyle. He had fears of ghosts traveling at night and if a snake comes. But if a snake is found in his house, he would kill it. No problem. No fear of it. Dreams. He had a dream that his mother's neck got a cut. I applied haldi and I was crying. Very attached to his mother. 6th standard to 12th standard, he was in the hostel. His mother would come and meet him every week or 2 weeks. Good appetite, craving chicken, eggs, sweets. History given by the wife. He gets angry easily, very sensitive, cries when he feels bad. In anger, throws pillow or bangs hand on the bed. He's the youngest of the 3 siblings, so he feels that his opinion is not considered in the family. He feels that they think that I am immature. Very concerned about his mother. If mother feels bad, then he feels like crying. He likes to dress up well, branded clothes, shoes, goggles, look unique whenever he goes in any function. He likes appreciation. Asthma got aggravated when his elder brother started saying separately. And that was when the whole responsibility of the house and the parents came on him. Now, the analysis of the case. First, I thought, what is it in the case that I have to treat? What I saw running throughout the case was he was a very sensitive, emotional person, weeping easily. So I knew I had to give a remedy from the plant kingdom. In the plant kingdom, then I thought I have to think whether I have to give a monocot or a dicot. So for monocot, it's like monocots are immature, less differentiated, they are selfish or self-centered, you would say the world revolves around them. But in dicots, they are more mature, well differentiated. They need others in order to define themselves. In this patient, we knew that the family, the wife, mother were all important to him. So I was sure that I have to give a dicot. It is then I referred to Dr. Yakir's book, Wondrous Order. I knew that we are dealing with column 4 issues because I'll just tell a few of them. In this column, the ego is seeking the nourishing energy it needs in order to develop mature qualities relating to love, nurturing, balancing between giving and receiving, and having enough for oneself. Issues of existential insecurity, issues of relationship with one's mother, and issues of position in one's family. He was talking about attachment to mother, family, his position in the family. So column 4 was well indicated. Okay, fine. And this is the delineative family where I came to column 4. Then I saw the row. Row was, I could see adolescence issues, identity issues, self-image, body image, overexcitement, fancies, planning, imagination, goal setting, fear of growing up as an adult and taking responsibilities, where this is a turning point in the table, where they have to now take up responsibilities. And it is what that time the asthma got really bad. So then few of this adolescence, the table I had put there. Then the remedy I gave from this was Anagallus arvensis. It is not that I ever had known this remedy, but what I read in the Materia Medica of this remedy was that extremes of emotions from enthusiasm and joy to sadness, from pleasure to anger. It's an allergic reactive remedy. This remedy is in the adolescent stage in its socializational aspect with the need to be sociable, cheerful and vibrant in order to be in the center and be socially acceptable. They want life to be a picnic. This is what I really found in the patient, and this is allergic remedy, though it is more indicated in skin, but he had asthma. I gave him the medicine. I gave him in 30 potency. Follow-up after a month. Breathlessness much better. No need to take any inhaler. At times sneezing and coryza. Anger reduced a lot. Stress no. The patient is with me maybe now I can say exactly for around 10 to 11 months rather. And rather now his wife is pregnant, but that has not aggravated his situation because it's going to be further responsibilities. I did have to go up to 200 and repeated it in water medicine, like deviation I give. Sometimes in between was needed, but off late he is not on medicine at all. Thanks a lot for giving me the time and a patient listening.
Thank you so much, madam. Thank you so much, madam, for your presentation. We can learn from your case that how we can apply this classification of plant, dicot, monocot, how the stages, superclass understanding. Thank you for this wonderful presentation.
So, good afternoon, everyone. I'm here to convey vote of thanks. So now we are at the end of the session. end of the 100th SODP session, for which first I would like to thank our Guru, Dr. Chandrasekhar Algundi sir, for providing us this platform and making us to grow in every aspect of life. So a deep gratitude, sir, on this day, on our 100th SODP. And secondly, I would like to thank Dr. Priyanka ma'am and Dr. Divya ma'am for sharing all their valuable insights from first to 100th SODP until this session. And I would like to thank all the presenters of today who have given their 100% effort to present their case, who have showed their skills in every angles and to make this event a great success. So thanks to all the presenters who have presented their case today, and these cases were a good learning for us, those who have witnessed the journey today for this past from 10 o'clock. And I would like to thank all the participants of this session. Without you all, this session would hadn't been a great success. And I would like to thank all the Swara family members and who are the part from first to 100th SODP. I thank each and every one from the bottom of my heart for joining this Swara online discussion portal. And we hope for much more journeys to continue and much more learnings via this portal. So thank you everyone. Thank you so much.